This is a demonstration of Allscripts Professional EHR for urgent care. Today we're going to demonstrate how Allscripts Professional EHR can overcome your daily challenges and help you achieve meaningful use. In urgent care practices, most providers are challenged with medication management, messaging, quick access to lab results, quick documentation, and letter generation to the primary care physician. Allscripts Professional EHR can help make your life a lot easier with fill history, the messaging module, result notification, template use, and pre-built referral letters. Now let's take a look at how Allscripts Professional EHR can help meet your practice's needs. You're logged in as Cindy Pope, the nurse for today's scenario. Here you see the schedule for patients that have walked in for appointments today. Any patient's name in green simply means they've been roomed. If the name is in blue, that means they're sitting in the waiting room, and the red means the patient is checked out. In this case, your patient, James Appleman, has already filled out his history and his review of systems in the portal from within your office. When the nurse goes in and pulls the patient's chart, she can actually see that information right away. You immediately see a reminder telling you to get a smoking assessment for this patient to meet meaningful use requirements. Here's the note in the history that's already been indicated by the patient, and then it's pulled into the patient's record. At this time, the nurse knows the patient is here for a sore throat, so she's going to pull a sore throat template and begin her documentation as she rooms the patient. You enter his weight here to begin the BMI calculation. You also document his blood pressure and his temperature, which is a little high. Once you add that to the record, you'll notice the BMI has been automatically calculated, which is a meaningful use requirement based off of the height and weight. The next item in the visit is the patient's complaint. Again, he is here for a sore throat, so the nurse will indicate that and then document any additional symptoms the patient may be experiencing. He has a sore throat with no nasal congestion. His glands are swollen, and he does have a slight fever, but he's not experiencing any chills. As you make your selections, you'll notice the note that is being created at the bottom of the screen. The patient indicates that this has been going on for 4 days. And now you've just added that to the record. At this point, the nurse will go in and will order a strep quick test for the patient. She pulls in a protocol for pharyngitis, which shows the ICD-9 code for a preliminary diagnosis, along with the orders to be placed for this patient's current condition. So you're going to do a strep quick test on the patient, but not a culture at this time. Once the order's been placed, the nurse can then result the order by clicking on the beaker to the left and enter the results. After completing the test, she determines the patient has strep because the lab test came back abnormal. This will now be attached to the chart and sent over to the provider's inbox, where they can see the patient from that point on. The note looks like this so far: the patient's reason for visit, the history that was entered in by the patient, vitals that have been documented by the nurse, and also the order for the strep test and the results that are attached to the chart. The nurse will send this to the inbox for the providers to pick up, or they can have a shared inbox to pull the patient's first come, first serve. At this point, the nurse puts a sticky note on the chart explaining that the patient is tired of waiting. She sends that over to the provider's inbox. You'll now log in as the provider. Dr. Ennis will go and check his inbox or the inbox shared by the providers to see which patient is next to be seen. This tells him exactly who the patient is, where they are roomed, and what time they checked in. You select James' record and you'll notice immediately that the sticky note put in by the nurse is displayed in the chart. A reminder displays here as well: the patient needs a smoking assessment. The provider will review the note and notice that the smoking assessment was not documented by the nurse or by the patient. So now the provider can walk into the room with the patient and get this information right away. To do that, he'll jump right to the history for this patient and find out if he's a smoker. You select from your template that the patient is a smoker. He smokes every day. He's been smoking for the past 2 years, and he smokes about a pack of cigarettes per day. That's been added to the patient's record along with his medications. Because this patient is in an urgent care practice, you really don't know what meds he's on. So you have the ability to use the fill history, which will pull in all meds for this patient that have been prescribed by other providers, as long as the patient used his insurance card to do so. In the fill history, you'll see the medications listed and when they were last written and last filled. Those meds can be pulled into the patient's chart. If there are medications that are over the counter at this time, You can very easily go in and select those from your list of choices. The patient is taking Advil every day for his knee pain, and he doesn't know what his dosage is. You can free text type and add that comment right into the patient's record. Thus far, you've met meaningful use requirements for an updated problem list. The nurse documented his sulfa allergy, which updated his allergy list, and you just updated his meds list. At this point, you'll say the meds list has been reconciled. The provider can then go back to the complaint and follow up with some additional questions for the patient, just to make sure that everything is covered. You'll go in and select the sore throat and talk to the patient some more about the radiation. Does it radiate at all? No, it does not. He says the quality is pretty bad and there's a sharp pain. Are there any other associated symptoms? The patient says he did have a slight headache, but there is no neck stiffness. As you add these choices here, it actually displays at the bottom of the screen, creating your documentation very quickly. There is no cough and no nausea. Over to the physical examination, there's a sore throat template already in place. Once you select and apply it, your template displays here indicating positive and negative findings for a patient coming in with a sore throat. So if there's anything you need to add to this, you can certainly do that by selecting the area of interest and then add anything else needed. Now that displays in your note, documented and updated to the patient's record. The provider can also view the results that were entered by the nurse. You see that the patient had a strep test done and the results were positive. At this point, you can sign off on those results, and then they are no longer in his queue. According to the results, the patient does have strep. You'll go in and select the strep diagnosis code here and pull it into the chart, which will then automatically pull in the prescription to be written and produce an education sheet to the patient. Again, there's the strep quick test that was put in by the nurse. Once these orders have been placed, they automatically file in the chart for the patient in the appropriate places. This is the final note along with the anatomical picture. Your assessment and plan indicates what you're going to do for this patient. The doctor can go in and simply select the qualifier for this diagnosis. This is a new problem with no additional workup planned. A prescription was written, and this is a new patient. When you select the Calculate button, it will go in, walk through the template selections, and then tell you at what level you should bill the service. The summary gives you the indications as to why Allscripts Professional EHR selected this service code. The history is focused. In order to achieve an expanded problem focus, you need to go back and get at least one review of systems. In this case, you're showing that 0 review of systems were pulled in. If you need to go back and pull that in because it was missed by the patient and by the nurse, you can very quickly pull in the review of systems that was entered by the patient and simply hit Apply. Now the review of systems has been dropped into the visit. You can go back to the note and see where it has been put into the chart. Then you run the E&M calculator again just to make sure that your code is appropriate for billing. When you calculate, you still receive a 99201. However, when you go to the summary, you'll notice it has now counted your bullet points for 6 review of systems. But Allscripts Professional EHR tells you in order to get a comprehensive rating, you need to document at least 10. If the provider wants to select their own code, they can skip this step altogether and then select their own code. You're going to sign off on the note, which then generates the super bill. Here's your office code for billing purposes, the ICD-9 code for the strep, and the quick test for the lab. The encounter pack will send a letter back to the primary care physician, an education sheet that can be printed off and handed to the patient, and also a clinical summary for the patient which meets meaningful use. You create all these items immediately at the time of sign-off and also write a prescription to the pharmacy. Here is the prescription for e-prescribing to the pharmacy. The patient's preferred pharmacy was not captured at the time of check-in, so you can pull in the patient's preferred pharmacy now. Ralph's is their preferred pharmacy, so you'll e-prescribe the amoxicillin directly to Ralph's. If the patient prefers to have it printed, you can select the printer icon and then print that off and give it to the patient. Finally, you look at the notes that will be generated, the patient's education sheet, the letter back to the primary care doctor, and a clinical summary for the patient. The first document that you'll look at is the letter back to the primary care physician. As you can see, this actually pulls in from the note. Here's your assessment and plan. Sincerely, Dr. Innes. Here's the education sheet for the patient indicating how to care for the strep throat. This sheet can also be edited if necessary. The clinical summary is a meaningful use requirement. generated to the patient about today's visit. Once that's been signed off, it files itself automatically into the patient's chart. Next, you'll take a look at the inbox to view some of the other items that are important for urgent care. Result notifications. Whenever orders are placed and they're electronically received back into the chart, they go directly to the provider's notifications inbox. All of the patients that you're seeing on this list have received abnormal results. To review a result, simply select the result, see what the results were that came back, hit Review All, and that will automatically sign off on all the results. If you want to send a message to the nurse, you can simply select the result that you want, send that back to the nurse, and that will be attached to the patient's chart. These results can be submitted to the patient through the portal along with a web message attached as well. The messaging feature allows for very easy inter-office messaging. Once a message is generated from a patient that's called in, that message is very quickly generated and sent over to the provider. For example, this patient called with a question. Once the provider opens that up, it shows here that the patient called in with their peak flow readings, and then the provider can reply back and tell the patient to have them call their primary care physician. Now this goes back to the nurse, telling her to call the patient, and also it'll be attached to the chart if this ever comes up again. That message is no longer in your inbox. Allscripts Professional EHR not only addresses your daily challenges, but connects to 180,000 physician users, 1,500 hospitals, third-party devices and applications, labs and pharmacies across the country. Allscripts practice management solution seamlessly. The Allscripts referral network. To patients through the patient portal. To patient charts remotely with our Allscripts Remote for Apple iPhone, iPod Touch, BlackBerry, or any Windows mobile device. It is your entire healthcare community connected. To request a custom ROI assessment or a personal product demonstration, please call Allscripts at 1-877-EHR-NOW1 or email ehrnow@allscripts.com or visit www.allscripts.com/professional.